Commissioners.
Ryan. Nice to meet you.
So Ryan, what brings you in today?
I'm just doing a yearly checkup for my insurance at work.
Have you had any problems lately?
No, nothing concerning or out of the ordinary.
When was the last time you saw a physician?
It's probably last year for this.
Are you currently taking any medications?
Nope, no prescription or anything.
You're taking anything over the counter? Any vitamins?
I take daily vitamins.
Like a Centrum Mins or?
It's just a Healthy Nature, one of the generic. It's a B12.
Do you have any past medical history and have you ever been diagnosed with anything?
I had meningitis in high school.
Did they really ever find out what truly caused that?
No, the doctor said I had it, so you're just gonna get me better, and that's it. So.
Were you hospitalized?
I was for one night, 2 days and a night.
What year would you approximately say that was in?
2007, 2008.
Any other things you have been diagnosed with?
I just
Ever
had
taken any medications?
just seasonal allergies. You just take Claritin or whatever happens to be on sale at the time.
So you only take the Claritin when your allergies act up, you don't take it for prevention?
Yeah, usually just if I wake up and realize they're not doing good, or if I know I'm going to be outside.
Have you ever had any surgery of any type?
Nope, no surgeries.
What about your family? Mom and dad have any diagnosis? Ever had any health problems?
Mom's got hypothyroidism. I think she's on levothyroxine for that, but that's about all I know.
What about your dad? Anything with your dad? Do you have any
No.
siblings?
Yes, got one older sibling, and he's in pretty good health. And 2 younger sisters.
Any of them have anything that you know of?
My older youngest sister was born with Poland syndrome.
What about maternal grandparents?
Maternal grandparents, my grandpa had a heart attack 6 years ago or so.
Did he have hypertension or anything that led to that you know of?
I don't think so. I think he was in pretty good health before that. It was kind of out of the blue.
What about maternal grandma? Nothing that you know of?
I don't think so.
What about, let's go to the paternal side, anything?
Yeah, a little bit more there. My grandpa had prostate cancer a couple of years ago. Grandma had breast cancer. I believe she just had double mastectomy. And then their daughter had breast cancer just a couple months ago.
So, paternal aunt.
Mm-hmm.
Okay, any other significant family history you can think of?
Nothing that comes to mind.
Okay. So, what do you do for a living?
I actually work at a hospital
What do you do there?
in transport.
So, what is transport? Do they like take patients
I just have
places?
to move them to tests or discharge them or room transfers and stuff. So.
So, you do a lot of physical exercise?
Yep. I
Do you
I move a lot.
do you do any exercise outside of work?
As much as I can. I try and get to the gym very often. Usually 4 days a week or so.
So, on average, would you say 4 days a week?
Mm-hmm.
How many minutes would you say when you're there?
Usually an hour. Close to an hour. It depends on how busy it is. Or...
Do you normally do lifts, cardio, or kind of
I usually do
match?
at least 45 minutes of weight training and then a little cardio before I leave.
What would you say about your diet? How would you describe your diet?
It's pretty good. I'd say it's better than average, but it could be better.
So tell me what you've eaten in the last 24 hours.
Well, since it's Friday, I've had a protein shake after I went to the gym today, and then a protein bar, and a glass of milk for breakfast, I think, with some toast and peanut butter. And then my usual water. I try and get a few glasses of water every day, so that's about it today.
And if it wasn't, I'm guessing you're saying it's a Friday, and since it's Lent season, you're probably Catholic. If it wasn't Friday, what would you say you would have eaten?
Maybe usually cook at home on the grill, some chicken breasts or some steaks or something. I like to eat a good amount of meat, but sometimes that gets expensive, so pizza every once in a while, but not too often.
You say normally pretty healthy, right? I kind of watched your eating. Okay.
Oatmeal or toast or something like that for breakfast. So.
Okay. Let's talk about your social history a little bit. Do you smoke?
Nope, never smoked.
What about alcohol intake?
I do drink alcohol. I'd say pretty average.
So how many drinks would you say you had in a week time span?
In this last week time span?
In a normal week time span.
A normal week? Maybe anywhere 10 to 12 in a normal week.
So you say 10 to 12, what are you consisting 10 to 12 drinks? What are you saying?
Usually beer. That's really all I...
So like a can of 10 to 12 cans?
Yeah. I'll have a glass of homemade wine every once in a while, but it's usually just one a night if I do that.
What about any recreational drugs? Have you ever used any type of drugs, and even in your past?
Nope.
Would you say, since you work in a hospital, do you have any occupational hazards, anything that you've been exposed to?
Well, I mean, I've dealt with patients with TB before, but usually I'm not in the room with them because of all the contagion and everything, but I mean, usually pretty good about hand hygiene and just normal hazards that come with working in a hospital.
Okay. Let's talk about some safety risks. Do you like wear a seatbelt when you're in a car?
Yeah, I always make sure I have my seatbelt on. I'm usually pretty good about not texting when I'm driving, but it happens every once in a while.
It's breaking the law in Illinois. Let's what about like sunscreen when you're outside in the summer?
I usually don't wear tanning lotion. It's usually like a 4 or 8.
You know that you're high risk for skin cancer by
Yeah.
doing that.
I know. That's really all we buy at our house. We don't have much else.
They say you should have at least 15 SPF to help protect against getting skin cancer.
I'll look into that.
So we're kind of talking about some health maintenance activities. When would you say you probably had any blood work drawn to just kind of screen for any type of risk factors?
Well, I had the normal drug and screening test when I got hired at the hospital.
When was that, would you say?
A little over 2 years ago.
Did a drug screen about 2 years ago?
Mm-hmm.
Have you had like your cholesterol checked, your hemoglobin A1C, and rule out any type of diabetes, or TSH with your mom's history?
Not that I can think of. I had a TB test.
And all of that, I'm thinking it was negative.
That was negative. Can't really think of anything else. I mean, maybe when I had meningitis at the hospital, they did some stuff. But.
Okay. As far as social history, what do you say you'd like to do in some of your spare time? Do you like to hang out with your friends? Do you like to spend time at home? Do you like to read?
I like to read when I have the time, but I'm in school right now, so that's kind of little. But I like to go to the gym as much as I can, hang out with friends if I can, but it doesn't happen too often.
Where do you live currently? Do you live alone? Do you live with someone?
I still live with my family right now until I get out of school.
What are you in school for?
Nursing.
Good career.
So I've been told.
Do you ever have you felt like you've been down or depressed at all in the last 2 weeks, or felt like you don't have meaning in life?
No.
Have you ever had any type of feelings of harming yourself in the past?
No.
Can you think of anything else you'd like to discuss or talk about before I start the physical exam?
I think you did a pretty good job. I think you covered most of it.
Okay, I'm going to step out and let you change into your gown, and then I'll be back in shortly.
Okay.
you have time to get dressed?
Yep.
Were you able to go to the bathroom too?
I did, yep.
Alright. So what I'm going to do now is I'm going to check you out. I'm going to start off by doing your vital signs.
Okay.
Did the nurse get your weight and height?
She did.
It looks like she said you weighed 170, is that right?
Yep.
And then 5'6"?
Yep.
Alright, can I take your blood pressure over here? (122/76), pretty much perfect.
I'm okay with that.
Alright, I'm going to check your pulse here. Pulse was 68. Alright. Can I just have you tell me your name and birthday again? I didn't write it down the first time.
Ryan Carmen, 5/15/90.
And can you tell me where you live? Just the town, not exact address. And tell me where you are right now?
Family Medical Center.
And do you know what the date is now?
4/23/15.
And can you tell me who the president is?
Obama.
You are correct there. Alright, I'm going to start off by just looking at your head here. Alright, can you smile real big for me? Can you stick out your tongue? Can you pump up your cheeks? Don't let me push them down. Can you shrug your shoulders? Then you let it down. And can you shrug them again? Can you turn your head this way towards your, yep, the other way. And then can you rotate your neck around? Good. Do you have any pain when I touch anywhere around here? Any sinus drainage or anything?
Nope.
What about down in your neck at all? No? Alright, I'm going to look in your mouth. You open up and say, ah.
Ah.
Alright, looks like you take pretty good care of your teeth there.
I tried to.
Well, that's good. How often do you see a dentist?
I actually have an appointment tomorrow.
Oh, that's good.
Yeah.
Let's go take a look in your ears. Any pain or anything in your ears at all?
Nope.
How about your nose? Any breathing problems?
Nope.
Take a big deep breath. And again.
Just the occasional stuffiness with allergies.
Yeah, and you take Claritin or whatever's cheapest, right?
Mm-hmm.
Can you open your jaw real big, close it, move it side to side? Any pain in here?
Nope.
Okay. You feel me touching you?
Mm-hmm. Yep. Yep.
Okay. You said you wore contacts earlier, correct?
Yes.
How often did you say you see the eye doctor?
Once a year at least. Sometimes every 6 months. It just depends on if I feel like my vision's getting worse or not.
Yeah. Alright, so what I'm going to have you do just look right at my nose. And then can you read to me what's on this paper here? You hold it about arm length away.
We here at FMC are interested in our patients' health. Walk with the Doc is a free walking program for everyone interested.
Alright, I think you can read it pretty good. What about, can you read over here what's on the wall? Can you tell me what this says?
April adults, immunizations. Have you had a tetanus shot in the last 5 to 10 years? Now is the time when you'll be working in flower beds.
Alright, I think you got it. Alright, so this is kind of, it's called tuning fork. We're going to just test your hearing a little bit.
Okay.
Alright, where are you hearing any noise right now?
Pretty much same in both ears.
Both ears?
Yeah.
No difference?
Not really.
What about now?
Pretty even.
What about now?
About the same. Probably better on the right when you were over there, but
Okay.
better on the left.
And then one last time here.
Pretty even, right in the middle. Kind of.
Okay, good. Just gonna check your carotid pulses. And you said your mom has hypothyroid, correct?
Mm-hmm.
Do you have any thyroid problems that you know of?
Not that I've been told of. I get tired pretty easily sometimes, though, so.
You're pretty busy though, really.
Yeah.
Any skin issues anywhere?
Just my ankle.
Just your psoriasis?
Yep.
Any moles or anything anywhere? No? Anything that looks concerning? You know what to look for with moles?
No changes or anything.
Okay. Great, so I'm going to look at your back here for a quick second while you're still sitting up. It's alright there. Any pain when I go down your spine at all?
Nope.
Alright, I'm actually going to listen to your lungs while I'm standing back here. Okay, maybe take some big deep breaths. Alright. So what I want you to do is take a big deep breath and hold it for a second for me. Alright, you can take it out. Any Any trouble with urination or anything?
Nope.
Any pain back here?
Nope.
Okay. All right, can you take a big deep breath for me? All right, good. Now I'm gonna have you, can you whisper 99 for me? Again? 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 Now I just want you to say E, E, E. Not right. All right. All right, so I'm going to actually take down your gown here. Take some big deep breaths for me. Again. 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 All right, you can just breathe normal. Almost done. Take a big deep breath and hold it. All right, let it out. So what I'm going to have you do now actually is, can you lay down for me? Put your gown back up. I'm actually just going to kind of pick up your gown right here. Okay, look at your belly. Having any pain?
Nope.
All right, I'm going to listen here. Let me know if you have any pain anywhere.
Nope.
Nothing?
Nope. It just tickles.
Sorry. Alright. Go ahead and sit up here. For psoriasis, how long have you had that, you said?
I don't even know. Many years.
Feet are cold.
Your hands are warm.
Okay. Doesn't look like you have any type of swelling or anything. Alright, so I'm going to test your reflexes here a little bit. Can you scoot to the edge just a tad bit more for me? Thank you. Relax a little bit, you're all tense.
I've never been good with these.
There we go, got a little bit from you. Alright, relax your arm here. These one-size-fit-all gowns are working wonderfully, right?
Mm-hmm.
Alright, now you squeeze my fingers, push me away, pull me towards you. Alright, you kick up this leg, this one. How about raise up? Over here. You push down, pull back up towards you. Alright, you can put your arms out, up, go around. Good job. Kick this one up, down, up, down. Move your ankles in circles. Alright, can I have you stand on the ground here for me? Alright, can you bend over and touch your toes? Alright, good. Stand up here. Just walk towards the wall here. Turn around and come back. Alright. Can you bend over and touch your toes? Can you squat like a duck? No. Time you're getting old.
I know, right?
Alright, you can have a seat up here. Do you have any questions or anything else I can answer for you or anything like that?
Not that I can think of right now.
Alright then, so I'll let you get dressed here in a second, and then I'll come back and just see if you have any questions.
Okay.